Hi everyone, and welcome to our discussion. My name is Instructor Oliver, and in today's lesson, we will be covering the Medicaid program. In this lesson, we will cover what the Medicaid program actually is, who are the folks that will be eligible to participate in the Medicaid program, and we will also review the services that are covered and included in the Medicaid program. So let's dig in. What is Medicaid? Okay, so Medicaid, unlike Medicare, is a jointly funded health insurance program funded by both the federal government and the state. Medicaid and its rules are individually crafted depending on the individual state, as long as the states follow the federal requirements. This type of health plan was created to help those in financial need to receive needed and necessary medical services. It has assisted many low-income and needy families and children throughout the years. So, who is Medicaid eligible? Individuals who are eligible for Medicaid must meet certain criteria set by each participating independent state. Income, family size and status, disability, and other factors may vary from state to state, but in essence, those who qualify would be low-income families. Each state has its own threshold of what the maximum income an individual couple may have in order to qualify for Medicaid. Since each state has authority over the eligibility requirements, monthly income requirements differ from state to state. So for example, an individual would have to meet a certain monthly income to qualify for Medicaid in my home state of New Jersey. An individual's monthly income must be below $1,063 a month. A couple would only be allowed $1,437 a month. In comparison to the state of New Mexico, an individual's monthly income would have to be under $783 a month, $1,175 for a couple. This shows how different the financial qualifications are from state to state. Others that would qualify would also be needy children, pregnant women, the elderly, and people with disabilities. Once an individual qualifies for Medicaid, they will receive a card and benefits that can be used like any other health insurance coverage through any other insurer. Medicaid can be an individual's only coverage, or it can work in conjunction with another plan, including Medicare. Federal law requires that Medicaid be considered the payer of last resort. This does not mean that services will not be covered or that a member can't rely on Medicaid for coverage when needed. It just means that Medicaid will pay after any other payer has paid its share of the services provided first. So an example can be if a person has Medicare coverage or any other type of private health coverage, Medicaid will always be the secondary payer. The doctor or healthcare provider will bill the primary payer first, and Medicaid will then consider the claim and may pay any balance due after the primary has paid. Okay. So in addition to the eligible population we discussed in our prior slide, Medicaid also has a categorically needy group, which is a state Medicaid program that must be available to mandatorily to this Medicaid eligibility group or mandatory population, because the federal government does provide matching funds. These groups are listed here on our slide, and basically they are families who meet states' Temporary Assistance for Needy Families, otherwise known as TANF, and the eligibility requirements for this went into effect on July 16th, 1996. Okay, so basically what this Temporary Assistance for Needy Family is, it's a program that makes cash assistance available on a time-limited basis for children deprived of support because of a parent's death, incapacity, absence, or unemployment. So it is a time-limited cash assistance program um, that was previously called the Aid to Families with Dependent Children, AFDC program. Okay. In addition to that group, pregnant women and children under age 6 whose family income is at or below 133% of the federal poverty level, so FPL. And the federal government sets annual income guidelines for this. The next grouping would be caretakers, so relatives or legal guardians who take care of children under the age of 18 or age 19 if they're still in high school. The next grouping would be supplemental security income recipients. In certain states that would, include the aged, blind, and disabled people who meet more restrictive requirements than those of the SSI program. And lastly, individuals and couples living in medical institutions who have a monthly income up to 300% of the SSI income. Let's take a look at the medically needy program. States that establish a medically needy Medicaid program expand eligibility to additional qualified people who may have too much income to qualify under the categorically needy group. Okay. Also, with this type of program, there is federal matching. So there are funds that the federal government matches, which allows these options. Individuals to spend down to Medicaid eligibility by incurring medical or remedial care expenses to offset their excess income. Thus, their income is reduced to a level below the maximum allowed by their state's Medicaid plan. And secondly, it allows families to establish eligibility as medically needy by paying monthly premiums in an amount equal to the difference between family income. So reduced by unpaid expenses, if any, incurred for medical care in previous months, and the income eligibility standard. States that implement a medically needy Medicaid program are required to include pregnant women through a 60-day postpartum period, children under age 18, certain newborns for 1 year, and certain protected blind people, right? States may also choose to provide coverage to other medically needy people, including the aged, blind, and or disabled persons, as well as caretaker, relatives, or legal guardians who live and take care of children and other eligible children up to age 21 who are full-time students. But there's a note here, so let's review the note. States are required to extend Medicaid eligibility to all children born after September 30th, 1983, who reside in families with incomes at or below the federal poverty level until they reach age 19. A state can choose to establish an earlier date to terminate the benefits. So, what is covered under Medicaid? So Medicaid covers a wide range of medical services, such as services as inpatient hospital care, physician office visits, outpatient hospital or clinic care, diagnostic services, pediatric services, and even transportation for medical care. In some cases, depending on the need and at a premium or a small co-payment, that the member would have to pay, some Medicaid programs will also offer optional medical coverage. This coverage can include services such as chiropractic care, prescription drug coverage, therapies such as physical therapy when medically necessary, eye exam and even eyeglasses, and dental services. However, there are certain healthcare services that Medicaid will not cover, and those would be medical services outside of the United States, cosmetic surgery, over-the-counter meds, and things like supplements. So those things they would not cover. Medicaid also covers medical care if the service is provided by a participating Medicaid provider, but because Medicaid does not reimburse doctors and other healthcare providers at the same rate as private insurance, many practitioners opt not to see patients who are covered by Medicaid as their only coverage. This concludes our review of the Medicaid program. Hope this presentation was informational. Thank you for watching and have a great day.